So, good afternoon, everyone. Today, I'll be presenting my seminar on grief and bereavement. I'm Dr. Riya Gupta, Junior Resident, Department of Psychiatry. So, in this seminar, we'll be covering about various definitions, the phenomenology, phases and types of grief, age and bereavement, complications, diagnosis, the neurobiology, differential diagnosis, assessment, and how to manage grief. So what is grief? Grief is basically, it is the subjective feeling precipitated by death of a loved one. Whenever someone in our family or someone close to us dies, we get a surge of emotions, which we call as grief. Mourning, it is basically the process by which we go through so as to resolve our grief. It is the societal expression of post-bereavement behavior and practices. Bereavement, bereavement literally means the state of being deprived of someone by death and refers to being in the state of mourning. Grief is an umbrella term in which grief comes. For example, even if we lose someone important to us, be it us undergoing going through a breakup, we are going through the process of bereavement. Grief is when it is death of someone. Now coming to stages of grief. The stages of grief was given by Elizabeth Kubler-Ross. We basically have 5 stages of grief. To remember these stages, you can learn it by a mnemonic called as DABDA. That is denial, anger, bargaining, depression, and acceptance. So, when it comes to denial, this is written in context to people who know that they might die in future or people who are suffering from a terminal illness. These people may appear dazzled at first, and then they even they may refuse to believe the diagnosis that and may deny that anything is wrong. Some people do not pass beyond this stage and may go from doctor to doctor until they find the doctor who supports them. The degree to which denial is adaptive or maladaptive appears to depend on whether a patient continues to obtain treatment even while denying the process. For example, if you've broken the news to a patient that you have a terminal illness and the patient denies it, not taking treatment, that means the denial is to a very high level, that they don't even accept the fact that there is something wrong. Now we come to anger, wherein the people question, why me? They may become angry at God, their fate, friend, family member. They may even blame themselves. They might displace their anger onto the hospital staff members and doctors whom they blame for the illness. These patients are challenging to treat. Coming to bargaining. This is negotiation basically, wherein the patient wherein the patient negotiates with friends, physicians, or even God in return for a cure. They promise to fulfill one or many pledges such as giving to charity and attending church regularly. कि मुझे बचा लोगे तो मैं इतना दान करूंगा या मैं रोज आप पे रोज मंदिर जाऊंगा. This is what bargaining is. Some patients believe that if they are good, compliant, non-questioning, cheerful, the doctor will make them better. ये बिहेवियरल वो भी करते हैं कि मैं अच्छे से रहूंगा, मैं अच्छे से बर्ताव करूंगा तो शायद मुझे बीमारी नहीं होगी या डॉक्टर मुझे जल्दी ट्रीट कर देंगे. Coming to depression, it is the 4th stage. Here people may show clinical signs of depression, which is withdrawal, that is social withdrawal, not talking to anyone, psychomotor retardation, slowness in the body, sleep disturbances, not falling asleep at night, waking up in the middle of night, yeah, excessive sleep comes under sleep disturbances. There is hopelessness that मेरे future में कुछ नहीं रखा हुआ है, possibly suicidal ideation that it's better to commit suicide rather than to deal with this thing. Then we have the depression may also be a reaction to the effects of the illness onto their lives. For example, if they're terminally ill, तो उसकी वजह से it has socially affected them a lot. For example, they might lose a job, economic hardships हो गई हैं, helplessness, hopelessness हो गई है, isolation from family and friends, or it may be in anticipation of the loss of life that will eventually occur. For example, कोई फैमिली मेंबर है, हेड ऑफ द फैमिली है, जो फाइनेंशियली सपोर्ट करता है अपनी फैमिली को, तो उनके डिप्रेशन के 2 कॉजेज हो सकते हैं. एक कि उनकी इलनेस की वजह से उनका सोर्स ऑफ इनकम कॉम्प्रोमाइज हो गया है. दूसरी कॉज ये भी हो सकती है कि उनको होपलेसनेस हो रही है कि नाउ माय लाइफ इज गोइंग टू एंड. that itself could be the cause of depression. Coming to the fifth and final stage, that is the stage of acceptance. Patients realize that death is inevitable and they accept the universality of the experience. The feelings can range from a neutral to a euphoric mood. Under ideal circumstances, patients resolve their feelings about the inevitability of death and can talk about facing the unknown, wherein they are comfortable about talking about the death that is going to eventually happen. That is what we call as the phase of acceptance. Coming to phenomenology of grief. So basically, it includes intense feeling states which might invoke a variety of coping strategies and lead to alterations. How does being in grief alters your life? It can alter your interpersonal relationships, your biopsychosocial functioning, the self-esteem, the world, the view with which you view the world. It can also last indefinitely. ठीक है, manifestations of grief reflect in the individual's personality, previous life experiences, past psychological history, significance of the loss, nature of the bereaved relationship with the deceased, existing social network, intercurrent life events, health and other resources. As in कि गया कौन है, आपका उसके साथ रिलेशन क्या था, आप उसके साथ क्लोज कितने थे, आपने उस ग्रीफ को कैसे हैंडल किया, उस सब पे ये चीज उस उन सब से आपका जो ग्रीफ जिस वे में आ रहा है वो सब इफेक्ट होगा. ठीक है. Despite individual variations in the bereavement process, investigators have proposed grieving process models. So there are a lot of grieving process models which include 3 partially overlapping phases or stages. ये bereavement ही बात हो रही है जो umbrella term है. ठीक है. इसमें 3 stages हैं. सबसे पहले आपका आएगा initial shock, disbelief and denial, which is corresponding to your denial wala stage. Then we have an intermediate period of acute discomfort and social withdrawal. ये तुम्हारा anger से लेके depression तक आ जाता है. And third is culminating period of restitution and reorganization, which is acceptance. ठीक है. So now I have shown this diagram which has phase 1, phase 2 and phase 3. There are various symptoms that you can find in phase 1. For emotion, we have numbness, throat tightness, then somatic में crying, sighing, abdominal emptiness, sense of unreality, thoughts में denial, disbelief. Similarly, phase 2 में anger, sadness, insomnia, anorexia, weakness, fatigue, guilt, dreams, thoughts of the dead, anhedonia, and introversion. Phase 3 में can think about the past with pleasure, regaining interest in activities and forming new relationships. The most important thing about this slide is that जरूरी नहीं होता that phase 1 के बाद phase 2 आएगा, के बाद phase 3 आएगा. पेशेंट ना इधर उधर घूम सकता है, हो सकता है एक दिन वो phase 2 में हो, वापस फिर phase 1 में आ जाए, फिर phase 3 में चले जाए. So there is no fixed pattern. The same comes with DABDA. Denial, anger, bargaining, depression or acceptance. Patient can move from one stage to the other. आगे पीछे हो सकता है. ऐसा कोई फिक्स नहीं है कि आप डिप्रेस हो गए हो तो अब नेक्स्ट एक्सेप्ट ही होगा, आप डिनायल में भी जा सकते हो पीछे. Coming to normal bereavement reaction, the first response to loss is protest, followed by a longer period of searching behavior. We search for the person we have lost. As hope to re-establish the attachment bond diminishes, searching behavior gives way to despair and detachment before the bereaved individuals eventually reorganize themselves around the recognition that the lost person will not return. Grief work, it allows the survivor to redefine his or her relationship to the disease and to form new but enduring ties. इसलिए ग्रीफ वर्क जो ग्रीफ थेरेपी होती है वो बहुत ज्यादा जरूरी होती है हमारे लिए, so as to we are able to process our grief and we can redefine our relationship with the deceased person. So now duration of grief. For school going children, we expect them to return to school within a few weeks, but approximately we say 6 months to a year लगता है. ठीक है. Ample evidence suggests that the bereavement process does not end within a prescribed interval. Certain aspects must persist indefinitely for many otherwise high functioning normal individuals. Okay, basically what we do is we try कि जो भी person जो grief कर रहा है, जो mourning phase में, उनको जल्दी से जल्दी उनकी social work में भेज दे. क्योंकि वो घर में जितना बैठेंगे उतना उनके लिए वो प्रोसेस डिफिकल्ट होता रहता है। इसलिए बच्चों को भी जल्दी जल्दी हम बोलते हैं कि स्कूल जाओ, अब हो गया, अब जाओ, अब काम पे जाओ, ताकि हम उनका ग्रीफ का जो पीरियड है और जो मोर्निंग का पीरियड है उसको थोड़ा इजी कर सके। The most lasting manifestation of grief, especially after spousal bereavement, किसकी वाइफ की डेथ होना, किसके हस्बैंड का डेथ होना, उनको सबसे बुरा जो खाता है दैट इज द लोनलीनेस। उनकी लोनलीनेस उनको हर समय फील होती है, ठीक है। अब क्या होता है, यूजुअली दीज रिएक्शंस बिकम इंक्रीजिंगली शॉर्ट लिव्ड ओवर टाइम, dissipating within minutes and becoming tinged with positive and pleasant effects. माने most of the time you can be pleasant about the memory and sometimes बीच में वो थोड़ा थोड़ा आपको दुख आता है। Such bittersweet memories may last a lifetime. Thus, most grief does not fully resolve or permanently disappears. Rather, grief becomes circumscribed and submerged only to re-emerge इन रिस्पॉन्स टू सर्टन ट्रिगर्स। वो कहते हैं दर्द कम नहीं होता, दर्द की आदत पड़ जाती है, दैट इज द थिंग, ठीक है। The stages are tools to help us frame and identify what we may be feeling. It is different for everyone and does not always happen in the exact order. It may revert before moving forward. जो मैंने तुम्हें बताया था stages के हम बीच में इधर उधर जा सकते हैं। Coming to types of grief and bereavement. Coming to anticipatory grief. These are the reactions which are brought by slow dying process of a loved one through injury, illness, or high risk activity. Although anticipatory grief may soften the blow of eventual death, it can also lead to premature separation and withdrawal, while not necessarily mitigating later bereavement. Mane, you know that someone close to your family is terminally ill and they are going to die. तो दो चीजें होती हैं, आप ना उनको धीरे धीरे सोशली विड्रॉ करने लगते हो कि इवेंचुअली दैट पर्सन इज डाइंग, सो मैं खुद को थोड़ा इमोशनली डिस्टेंट कर लूं। दिस माइट सॉफ्टन द ब्लो ऑफ इवेंचुअल डेथ, बट जरूरी नहीं है कि उनके जाने के बाद जो प्रोसेस है उसमें भी कुछ इफेक्ट पड़ेगा। एट टाइम्स द इंटेंसिफिकेशन ऑफ इंटिमेसी ड्यूरिंग दिस पीरियड may heighten the actual sense of loss, even though it prepares the survivor in other ways. हो सकता है people either they go with social withdrawal or they become very close to the person. Okay, so that actually heightens your actual sense of loss. Coming to anniversary reactions, this is कि अगर someone in your family has died, तो जब उनका बर्थडे होता है, आपका बर्थडे होता है, जब उनकी डेथ एनिवर्सरी आती है, या जब आप उस एज के बनते हो जब वो पर्सन की डेथ हुई थी, तब आपको सिमिलर ग्रीफ मिलता है जैसे वो उसी दिन गए हों। दैट इज व्हाट यू कॉल्ड एज एनिवर्सरी रिएक्शंस इन सिंपल प्लेन टर्म्स। When the trigger for an acute grief reaction is a special occasion, such as a holiday, birthday, the rekindled grief is called an anniversary reaction. It is not unusual for anniversary reactions to occur each year on the same day the person died, or in some cases when the bereaved individual becomes the same age the deceased was at the time of death. Although these anniversary reactions tend to become relatively mild and brief over time, they can be experienced as reliving the once original grief and prevail for hours or days. Chronic grief. Okay, it is the most common type of complicated grief. It is heightened by bitterness and idealization of death. As in जो गए हैं उनसे better कोई था ही नहीं. Okay, you become very bitter from inside. Chronic grief is most likely to occur when the relationship between the bereaved and the deceased have been extremely close, ambivalent, or dependent, or when social supports are lacking, like they do not have people who can support them, and friends and relatives are not available to share the sorrow over the extended period of time needed for most mourners. Delayed grief. Absent or inhibited grief, when one normally expects to find overt signs and symptoms of acute mourning, is referred to as delayed grief. जैसे किसी के घर में किसी की डेथ हुई है, वो उस टाइम पे नहीं रोए, दैट इज समवट, वो बाद में उनका ग्रीविंग प्रोसेस ही बाद में स्टार्ट हुआ है, उसको हम डिलेड ग्रीफ बोलते हैं। दिस पैटर्न इज मार्क्ड बाय प्रोलॉन्ग्ड डिनायल। उनका फर्स्ट स्टेज बहुत प्रोलॉन्ग्ड होता है, प्रोलॉन्ग्ड डिनायल, एंगर एंड गिल्ट, एंड मे कॉम्प्लिकेट इट्स कोर्स। Hypertrophic grief. This happens when the death was never expected. It is most commonly seen after sudden and unexpected death. जैसे किसी की रोड ट्रैफिक एक्सीडेंट हो गई, तब यूजुअली आपको हाइपरट्रोफिक ग्रीफ मिलेगा। इसमें the reactions are extraordinarily intense, Customary coping strategies are ineffectual to mitigate anxiety, and withdrawing is infrequent. When one family member is experiencing a hypertrophic grief, reaction and disruption of the family stability can occur because ये reaction बहुत strong होता है, क्योंकि आपने कभी सोचा नहीं होता है कि ऐसा कुछ हो जाएगा, तो वो खुद को इतना नहीं संभाल पाते कि वो अपने आप को फाइनेंशियली स्टेबल रख पाए. हाइपरट्रोफिक ग्रीफ फ्रीक्वेंटली टेक्स अ लॉन्ग टर्म कोर्स, albeit one attenuated over time. मतलब इसको इस ग्रीफ से निकलने के लिए it takes a longer course as compared to the other types of grief. Traumatic bereavement is basically chronic plus hypertrophic. ठीक है? This is very severe. It is characterized by recurrent intense pangs of grief with persistent yearning, keening and longing for the deceased, recurrent intrusive images of the death, and a distressing admixture of avoidance and preoccupation with the reminders of its loss. इसमें क्या होता है ना, पॉजिटिव मेमोरीज ब्लॉक हो जाती है. मोस्टली जो हमारा नॉर्मल ग्रीविंग प्रोसेस होता है उसमें हमेशा हम अच्छी मेमोरीज को भी चेरिश करते हैं, बट इन ट्रॉमेटिक बेरीवमेंट positive memories are often blocked or excessively sad, or they are experienced in prolonged states of reverie that interfere with daily activities. A history of psychiatric illness appears to be common in this condition, as is a very close identity defining relationship with the deceased. Okay, age in bereavement. This basically shows कि हर इंसान अलग जो अलग अलग different age groups पे है, वो किसी भी loss को differently react करता है. For example, a child who has had a loss in the family less than 2 years, उसकी जो आपको symptomatology दिखेगी वो loss of speech हो सकता है या diffuse distress हो सकता है कि एकदम से आवाज ही चली गई बच्चे की. Children less than 5 years उनको problems हो जाएंगी eating में, sleeping में, bowel bladder dysfunctions हो सकते हैं. स्कूल एज चिल्ड्रन फोबिक हो सकते हैं, हाइपोकॉन्ड्रियाकल हो सकते हैं, विड्रॉन हो सकते हैं, सूडो मैच्योर हो सकते हैं. सूडो मैच्योर होता है कि एकदम से फॉर एग्जांपल अ पर्सन हु इज इन 9th 10th या व्हाटएवर क्लास, उसके घर में किसी की डेथ हो गई, दे विल सडनली बी मैच्योर, एज इन की सारी दुनिया की समझ एकदम से आ गई है. दैट इज सूडो मैच्योर. एंड स्कूल परफॉर्मेंस इन पीयर रिलेशंस ऑफन सफर. adolescence में मेल्स में मोस्टली सोमैटिक सिम्टम्स होता है, erratic moods to stoicism होता है, and adolescent boys में also after losing a parent may become delinquent. Adolescent girls का coping different होता है, they may turn to a sexual partner for comfort and reassurance. Complications of grief and bereavement. Okay, so medical illnesses क्या होती हैं associated with grief? These are fear of one's own health. मोर्टालिटी बढ़ जाती है, जैसे इस्कीमिक हार्ट डिजीज हो सकती है, पेशेंट माइट जस्ट सुसाइड, लोग अल्कोहल कंज्यूम करना शुरू कर देते हैं तो उससे सिरोसिस हो सकता है. मोस्टली मेल्स होते हैं जो कोप अप, जिनका कोपिंग थोड़ा कम होता है ग्रीफ से. देयर इज आल्सो इंक्रीज्ड रिस्क फॉर मेजर डिप्रेसिव डिसऑर्डर, prolonged anxiety, panic, post traumatic stress like syndrome, increased alcohol, drug and cigarette consumption. ठीक है, अब साइकाइट्रिक कॉम्प्लिकेशंस ऑफ बेरीवमेंट, ये वो है जो आईसीडी में लिख रखी हैं. एडजस्टमेंट डिसऑर्डर्स, एमडीडी, एंजाइटी, पैनिक, पीटीएसडी, एटीपीडी, डिस्थाइमिया, acute stress reaction, dissociative amnesia, overreacting associated with other psychological disturbances, personality changes, sexual dysfunctions, and increased substance use along with risk of suicide. Coming to diagnosis. Now coming to ICD. ICD में there has been no chapter जो grief को as a disease बताता है. For them it's a normal process. But कभी कभार अगर grief is out of proportion or the reaction is out of proportion, we can categorize the person as acute stress, mostly coded as F43.22, F43.23 and F43.25. ये mostly तब होता है when your symptoms persist for more than 6 months. Okay, so this slide explains you the adjustment disorders. It can occur within 3 months of the onset of stressor. There are marked distress that is out of proportion to the severity or intensity of the stressor, taking into account the external context and the cultural factors that might influence the symptom severity and presentation. Point 2 इसमें आता है significant impairment हो जाएगी. Point C है, it might not meet the criteria for another mental disorder and is not merely an exacerbation of a pre-existing mental disorder. These symptoms do not represent normal bereavement. E. Once the stressor or its consequences have terminated, the symptoms do not persist for more than additional 6 months. You do not किसी को भी हम साइकाइट्रिक इलनेस में तब तक नहीं डालेंगे जब तक उसकी सोशल साइको सोशल फंक्शनिंग इम्पेयर नहीं होती है, बिकॉज इमोशंस नॉर्मल होते हैं, एवरीबडी गोज थ्रू दोज इमोशंस. कमिंग टू DSM-5, इसमें कोड है V62.82 which corresponds to Z63.4 of ICD which shows uncomplicated bereavement. ठीक है. It exclusion criteria for adjustment disorder, the symptoms should not represent normal bereavement. और other specific trauma and stress related disorders को भी हमने other reactions to severe stress में आ जाता है. ठीक है. अब DSM-5 के हिसाब से there is something called as persistent complex bereavement disorders which has a diagnostic criteria. सबसे पहला ये होता है that the individual experienced the death of someone with whom he or she had a very close relationship. Since the death, at least one of the following symptoms is experienced on more days than not and to clinically significant degree that has persisted for more than 12 months adults में and more than 6 months bereaved children में. Okay, so B में point number 1 है persistent yearning, longing for the deceased. In young children, yearning may be experienced in play and behavior, including behaviors that reflect being separated from and also reuniting with the caregiver or other attachment figures. Next, you have intense sorrow and emotional pain in response to the death, preoccupation with the disease, preoccupation with the circumstances of the death. In children, this preoccupation with the disease may be expressed through the themes of play and behavior. Okay, and may extend to preoccupation with possible death of others close to them. Basically उनमें ना कभी-कभार fear बन जाता है कि एक family member गया दूसरा तो नहीं चले जाएगा, या वो थोड़े से उनका जो चीजें देखने का नजरिया होता है वो चले जाता है, उनके गेम्स डिफर हो जाते हैं. दे माइट मतलब बहुत सारे चिल्ड्रन में हमने देखा हुआ है कि उनमें ज्यादा गुस्सा आ जाएगा या वो हॉरर शोज ज्यादा देखेंगे, ये भी होता है. Since point number C, since the death, at least 6 additional symptoms are required of the following symptoms. जो next slide पे आएगा. 6 additional symptoms are required of the following symptoms are experienced on more days than not and to a clinically significant degree and have persistent for at least 12 months in adults and 6 months in bereaved children. माने अगर 10 दिन है तो 10 में से 6 दिन में वो symptoms तुमको दिखने चाहिए, तभी तुम ये वाला criteria fulfill करोगे. These are 12 points. 12 points में से 6 points अगर तुमको दिखते हैं तो that comes under complicated bereavement. Reactive stress to death. First is marked difficulty accepting the death. In children, this is dependent on the child's capacity to comprehend the meaning and the permanence of death. Second is experiencing disbelief or emotional numbness over the loss. Third is difficulty with positive reminiscing about the deceased. Like उनका कुछ positive याद ही नहीं आता है. Bitterness or anger related to the loss. Fifth, we have maladaptive appraisals about oneself in relation to the deceased or the death. That is, you can also start self-blaming yourself कि मेरी वजह से सब कुछ हुआ है. Excessive avoidance of reminders of the loss. Example, avoidance of individuals, places or situations associated with the deceased. In children, they may include avoidance of thoughts and feelings and regarding the deceased. As in, मैं इस जगह अपने किसी रिलेटिव के साथ जाता था तो मैं अब उस जगह नहीं जाऊंगा, मुझे याद आती है, मुझे नहीं जाना उस जगह. So that is when you start avoiding things. Next is a desire to die in order to be with the deceased. Difficulty trusting other individuals since death. If I also die, I will be able to meet my parent. So that's why I want to die. Next is there is trust issues, difficulty trusting other individuals since the death, feeling alone or detached from other individuals since death. उनके अलावा बाकी लोगों से भी आप distant हो जाते हो, आप attach नहीं हो पाते हो. Feeling that life is meaningless or empty without the deceased, or the belief that one cannot function without the deceased. Confusion about one's role in life, as in ये तो चलेगा, अब मेरा क्या काम है. That is what is 11 point. Or a diminished sense of one's identity, feeling that a part of oneself has died with the deceased. Difficulty or reluctance to pursue interests since the loss or to plan for the future. Next point is the disturbance causes clinical significant distress. or impairment in social, occupational, and or other important areas of functioning. The bereavement reaction is out of proportion or inconsistent with cultural, religious, and age-appropriate norms. ये criteria तो हर psychiatric illness के लिए होता है. If with traumatic bereavement, bereavement due to homicide or suicide with persistent distressing preoccupations regarding the traumatic nature of the death, often in response to lost reminders, including the disease, last moments, degree of suffering and mutilating injury, or the malicious or intentional nature of the death. ठीक है, अब इसका prevalence देख लो, 2.4 to 4.8. Development at course, grief can be experienced after the age of 1 year. 1 साल से ऊपर का बच्चा भी grief कर सकता है. Symptoms usually begin within the initial months after the death. Usually there may be a delay of months or even years before the full syndrome appears. Although grief response commonly appear immediately following bereavement, these reactions are not recognized as persistent complex bereavement disorders until the symptoms persist beyond 12 months for adults and 6 months for children. Coming to neurobiology. ठीक है, now we'll study कि कौन सा ब्रेन का कौन सा पार्ट हमारे कौन से इमोशंस और कौन सी मेमोरी को निकालता है. ठीक है, तो grief it is both physiological and emotional. ठीक है, there is a disruption of biological rhythms. It is accompanied by impaired immune functioning. You tend to get more sick when you're sad, as there is decreased lymphocyte proliferation and impaired functioning of the NK cells, that is the natural killer cells. Whether the immune changes are clinically significant has not been established, but the mortality rate of widows and widowers following the death of spouses is higher than in general population. Widowers appear to be at a risk longer than the widows. मतलब males में death after the death of a spouse is more, उनकी probability more होती है as compared to जो females होती हैं. The experience of grief tends to activate both specific brain areas linked to the aspect of grief that's primary in the moment and a more general network of structures and processes. Coming to कौन से brain areas involved in, that is the parasympathetic nervous system, हमारी frontal lobes हो गई, cingulate gyrus, insula and amygdala. अभी बताऊंगी. ठीक है, PNS में क्या होता है? PNS it includes ANS. It includes ANS. It maintains the functions of rest and digest. Sympathetic wing जो होता है वो fight and flight होता है. You can activate it by breathing relaxation, improving heart rate variability, that is intense cardio exercise, yawning, positive emotions, and fiddling the lips. Frontal lobes के grieving related functions are finding meaning, planning responses to loss, bringing verbal thought to emotion and somatic process, controlling problematic expressions of feeling and desires. Activate it by having conscious reasons for self-care and to be with oneself. When you care for your own self, you're actually strengthening your frontal lobe. ठीक है, deliberately exercising the will, make intentions conscious, multimodal and vivid. Call to mind a strong sense of the desired stage, giving instructions to oneself कि मुझे ये करना है, मुझे ये करना है. That is, you're strengthening your frontal lobe. Re-intend at short intervals. Cingulate gyrus जो होता है, it helps in retrieving the autobiographical memories with the person, integrating emotion and memory and thinking and feeling, controlling attention, interest in other people. We can activate it by careful crafting या precision sports. Deliberately linking emotion and memory, जैसे making a scrapbook, तो आपकी cingulate gyrus strong होगा. Linking thinking and feeling, like speaking one's experience or reflecting about it in the present time or through therapy. Insula, grieving related functions is sensing internal bodily functions, especially visceral states. It is involved in the sense of weight, heaviness, even loss of some literal part of oneself. जब लोग बोलते हैं ना कि दिल बैठा जा रहा है, पेट में कुछ हो रहा है, ये कहीं ना कहीं इंसुला में आता है. Activate and strengthen it by internal sensing activities like yoga and abiding in physical pleasure. Amygdala क्या है? It interprets stimuli as unpleasant and sends instructions to avoid or to resist them. Nightmares is due to amygdala. Major role in traumatic components to grieving. Incline the amygdala more positively by shifting memories in a positive direction. Memories are not recalled but reconstructed. Infuse the reconstruction with positive qualities such as compassion, encouragement, forgiveness practices. Differential diagnosis. अभी bereavement को major depression से कैसे करना है ये भी सीख लो. ठीक है. In grief, the predominant effect is feeling of emptiness and loss. बल्कि MDE, that is depression, it is persistent depressed mood and the inability to anticipate happiness or pleasure. ठीक है. The dysphoria and grief is likely to decrease in intensity over the days to weeks and occur in waves. बुरा waves में लगता है हमको. And so called pangs of grief. These waves tend to be associated with thoughts or reminders of the disease. जबकि डिप्रेशन में ना इट इज परसिस्टेंट. तुम्हारा लो मूड इज परसिस्टेंट एंड नॉट टाइड टू अ स्पेसिफिक थॉट और प्रीऑक्यूपेशन. The pain of grief may be accompanied by positive emotions and humor that are uncharacteristic of the pervasive unhappiness. Depressed बंदा हमेशा ही दुखी रहेगा. ठीक है. And misery characteristic of a major depressive episode. The thought content associated with grief generally features a preoccupation with thoughts and memories of the deceased, rather than self-critical or pessimistic ruminations seen in MDE. Grief में ना self-esteem preserved होती है, MDE में हमारी self-esteem reduce हो जाती है. We get feelings of worthlessness, self-loathing, which are very common. ठीक है. 6th point है, if self-derogatory ideation is present in grief, it typically involves perceived failings with the disease, not visiting frequent. जैसे हमें लगता है कि हम उनसे मिले नहीं, हमने उनको ये नहीं बताया that how much do they love them. If bereaved individual thinks about death and dying, such thoughts are generally focused on disease and possibly about joining the disease, that I want to die because I want to meet them, not because I want to end my life. The thought of I want to end my life comes in depression. Whereas in major depressive episodes, such thoughts are focused on ending one's own life because of feeling of worthlessness, undeserving of life, and unable to cope with pain of depression. ठीक है. ये टैबलेट फॉर्म में सेम चीज लिखी हुई है. ओके. तो हम इसको भी समझ सकते हैं दोबारा. तो ठीक है. काफी इजी है. अब कमिंग टू ग्रीफ वर्सेस पीटीएसडी. तो अभी हम ग्रीफ से हमने डिप्रेशन को सेपरेट किया, अब हम पीटीएसडी को सेपरेट करेंगे. Unnatural and violent death such as homicide, suicide or death in context to terrorism are much likely to precipitate PTSD. ठीक है. जब PTSD होता है ना तो patients might have themes of violence, victimization and volition, like that is a choice of death over life, as in case of suicide, are intermixed with other aspects of grief and traumatic distress marked fear, horror, vulnerability, disintegration of cognitive assumptions ensues. ठीक है. जब पीटीएसडी होता है ना तो मोस्टली वायलेंट डेथ्स हो जाती हैं. डिसबिलीफ, डिस्पेयर, एंजाइटी सिम्टम्स, प्रीऑक्यूपेशन विद द डिजीज एंड द सर्कमस्टेंसेस of the death, withdrawal, hyperarousal and dysphoria. Dysphoria is not being in a pleasant mood is called as dysphoria, are more intense and more prolonged than they are under non-traumatic circumstances, and an increased risk may exist for other complications. Now you can also separate bereavement from separation anxiety disorder. Intense yearning or longing for the deceased, intense sorrow and emotional pain, and preoccupation with the deceased or the circumstances of the death are expected response occurring in bereavement, whereas fear of separation from other attachment figures is central in separation anxiety disorder. मतलब you feel कि हम जिससे अटैच्ड हैं हम उनसे दूर हो जाएंगे, उस चीज का हमें फियर होना, दैट इज कॉल्ड एज सेपरेशन एंजाइटी डिसऑर्डर. ग्रीफ असेसमेंट. हाउ डू वी असेस ग्रीफ? सबसे पहला क्वेश्चन है व्हाट वाज योर रिलेशनशिप, व्हाट वाज द एज ऑफ द डिजीज, आप कितने अटैच थे, उनकी डेथ हुई कैसे, कोई हिस्टोरिकल एंटीसीडेंट्स तो नहीं है, पर्सनालिटी कैसी है, कोई कोप अप अच्छा करता है, कोई कोप अप नहीं कर पाता, हिस्ट्री ऑफ साइकाइट्रिक प्रॉब्लम्स, हैव यू had a psychiatric illness in the past or not, and we have various social variables जैसे social support कैसा है, आप employed हो, आप unemployed हो, Yeah, coming to management, the best management for someone mourning or of a mourner or patient undergoing grief is therapy. Therapy is the best. Persons in normal grief seldom seek psychiatric help because they accept their reaction and behavior as appropriate. Accordingly, a bereaved person should not routinely see a psychiatrist unless a marked divergent reaction to the loss is noted. For example, under usual circumstances, a bereaved person does not make a suicide attempt. If someone is making a suicide attempt, they need to go and see a psychiatrist. If someone seriously contemplates suicide, psychiatric interventions is needed. Now, how we have specific ways to help others cope up with loss. सबसे पहले ask if they want to talk about their loss. You don't have to force them to talk. You just need to give them the choice whether you want to talk about it or not. Just sit with them. You don't have to say anything to comfort them. Allow them to cry and be sad. Do not minimize their feelings. Don't show your care by words and actions. सिर्फ बोलने से कुछ नहीं होता. You really need to show them how that you are supporting them. Help with practical needs. When professional assistance is sought, it usually involves a request for sleeping medication from a family physician. Mostly जब professionally उनको कुछ मदद होती है तो usually उनको लगता है कि हमें थोड़ा नींद में प्रॉब्लम हो रही है तो हमें कुछ दे दो जिससे नींद अच्छी आ जाए. You can give a mild sedative to induce sleep. It may be useful in some situations, but antidepressant medications or anti-anxiety agents are rarely indicated in normal grief. Bereaved persons may have to go through the mourning process. However painful it is, for successful resolution to occur, for example, you cannot run away from mourning. You need to mourn throughout so that your grief can be resolved. Because grief reactions can develop into a depressive disorder or pathological mourning, specific counseling sessions for those bereaved are often valuable. In regularly scheduled sessions, grieved persons are encouraged to talk about their feelings of loss and about the person who has died. Many bereaved persons have difficulty recognizing and expressing angry or ambivalent feelings towards a deceased person, and they must be reassured that these feelings are normal. Even if it is anger, it is denial, it is bargaining, they need to be told that these are stages and this is normal when you're grieving. Grief therapy need not be conducted only on a one-to-one basis. It can be grouped. Like it can be, the group counseling is also as effective. Self-help groups offer companionship, social contacts, and emotional support. They eventually enable their members to re-enter society in a meaningful way. Bereavement care and grief therapy have been most effective with widows and widowers. The necessity for this therapy stems in part from the contraction of the family unit. Extended family members are no longer available to provide the needed emotional support and guidance during the mourning period. Grief therapy usually तब देनी पड़ती है जब हमारी जो extended family होती है उनकी तरफ से हमें support नहीं मिलता है. The components of grief counseling, key areas of focus, it focuses on helping persons process the grief. ठीक है, ये चार जगह पे फोकस करता है. The grief counseling, counseling is short term and focuses on helping people work through the grieving process related to a major loss. Grief counseling is also called as bereavement counseling, but the term bereavement usually is used when referring to the loss of a person through death. It has four components. First is learning about grief and what to expect when grieving. In grief counseling, people are taught about the normal grieving process, including expected feelings and thoughts. They are also taught how to tell the difference between normal grieving and other conditions such as depression that can develop from grieving. Expressive feelings. People are encouraged to grief counseling to express their feelings, whatever they may be. Sometimes people who are having trouble expressing their feelings are encouraged to talk about their loss or use other means of expressing themselves. For example, they may be asked to speak with the lost person as if you're communicating with them and imagining them and then communicating with them as though he or she was there. Other techniques that help people express their feelings include writing letters about the loss or writing to the lost person, like writing a letter to the person you have lost, looking at photos and remembering the lost loved one, or object, or visiting the grave of a loved one who has died. Third is building new relationships. The component of grief counseling helps people develop a new relationship with the lost person or object. Since memories usually linger for years and can sometimes be troubling, emphasis is placed on learning how to incorporate members of the past into the present. Next and the last step is developing a new identity. During grief counseling, people are taught how to develop a new sense of self after a loss. For example, a top corporate executive who retires strengthens his or her self-perception as a grandparent and spouse instead of a corporate leader. A widow who has lost her husband of 68 years begins meeting with other women and in her building for tea every morning. Coming to summary, we have learned what is grief, what is bereavement, what is mourning, what are the different stages of grief, what are the psychiatric complications that come with grief, different types of grief. We have also studied the differentiation between grief, MDD, PTSD, and separation anxiety. Then we have also worked about various neurobiology, as in which structure of the brain is involved in which process of grief and how to strengthen it. Then we have also learned about grief work or grief therapy, that is the most important one. These are my references. Thank you so much for your time.